because that's what it's all about. It's optimization of getting your body to heal itself. And with what we use that comes from your own body, your own blood, your own bone marrow, your own adipose, is really getting to the core or the root of the issue and helping it heal.
Hey, smart chiropractors, and welcome to Clinical Conversations. We're going to have an awesome episode today. I'm here with my co-host, Dr. Jason Deitch, partner in Smart Chiropractor, and we have a special guest, Dr. Brandon Money, who's tuning in all the way from Colorado. We're going to talk a lot about his expertise in golf, how he got into healthcare to begin with, as long as some additional fun facts along the way. If you have any questions, drop them down below. How are you gentlemen doing today?
Wonderful.
I'm doing great. It's great to be here. And Dr. Money, it's awesome to have you here. We've gotten to know you, gotten to know a lot about your history, and I'll say how much we all have in common, which is, really very much why you're here. And I think on behalf of Jeff and everybody, I want to thank you for taking some time here. How are you doing today, Dr. Money?
Doing great. Absolutely. Had an early start to the morning, but that's the way I prefer it.
I like it. So I want to get into TPI, Titleist Performance Institute, your interest in golf, how that informs your clinical practice. But before we do that, I always love asking the question where we peel things way back. What got you interested in becoming a physician in healthcare to begin with? I'd love to know a little bit more about your origin story, and we'll build our way into what you're up to today.
I was not prompted with this question, by the way, Jeff. No, my mother was actually the office manager for an OBGYN practice when I was probably 5, 6, 7 years old. So I was never there during the week, but I would be there on the weekends whenever she had office work to do, and sometimes the physicians would stop by. So that's probably what really planted the seed, just being around the environment. My parents are medical. My father works in construction. My mom's done a whole bunch of different jobs in the past, but it's the one thing where we can really make an impact on people, and especially with our field of medicine specifically, their lifestyle. We get people back to doing what they want to do, and that's what it's all about.
Dr. Money, historically, I think it's probably pretty obvious. Many chiropractors have felt a sense of prejudice or prejudgment about what chiropractic is, how it works, whether or not to work with chiropractors or not. I know you've got a great experience working with chiropractors, being trained, with and by chiropractors at TPI. Dr. Greg Rose, phenomenal expert, and has really sort of changed the game, so to speak. Help people understand sort of your connection, your experience, and also, I guess, your appreciation for what we know as chiropractors and what you do, not only in your training as an osteopath, but specifically in regenerative medicine. A lot of chiropractors are unfamiliar with regenerative medicine. Some chiropractors are familiar with regenerative medicine, but perhaps not necessarily in the correct and legal and appropriate way. Maybe help those watching either live or on the replay get to know you. And part of our agenda, before you answer that, for people watching, is we strongly believe, with our experience with you and the other doctors at the Centeno Schultz Clinic, that we are together a really great pair in helping people get well, stay well, avoid drugs, in many cases avoid surgery, and depending on where they are in their sort of injury status, if they're early on, chiropractors will help them. If they're a candidate for surgery, usually you can help them avoid surgery. Help our chiropractors get to know, your experience with chiropractic, and kind of the great working relationship you have with chiropractors helping people get well and stay well.
Yeah, absolutely. What we do is try and get the body to heal itself. It's not magic potion. It's not fairy dust, regardless of some of the advertisements that you'll hear. We are about enhancing the body's natural ability to heal. When we're kids, we can bounce around and get injured, and we're fine the next day. Unfortunately, as we get older, our repair mechanisms don't work as well. So that's where we come in often whenever more conservative measures don't get the patients to where they want to be. So if you're a patient and you've gone through physical therapy, you've gone to see a chiropractor, you've had dry needling, you've had manipulation, and those get you back to doing the things you want to do, that's great. Because I'm all about doing the least invasive thing possible, the least risky, the least invasive thing possible. If you don't need me, that's perfectly fine. But where we step in is when we get our referrals from chiropractors, from therapists, from other physicians that haven't been able to help the patient reach their goals. And when that happens, they call us and say, hey, we need some extra help. Let's step in. So the referral system from other adjunct professionals, chiropractors, therapists, etc., bringing them to us. And then conversely, I'm not going to attempt any injection on any patient if I know that they're not going to put in the work afterwards. And what I tell patients is kind of think about bodybuilding. Bodybuilders, the professional ones will pump their body full of the anabolic steroids. But if they just sit on the couch, they're not going to grow any muscle. Well, I can inject everything in your body, but if you just sit on the couch and don't do anything, you've wasted all of our time. So we send our patients back to those other professionals to get them stronger, enhance stability, regain some of the alignment that's necessary in order to function properly.
That's so awesome. There's so many correlatives, and Jason's pointed this out a few times as we've talked to some of your colleagues. Man, there's just so many correlatives between, so complementary of how you think about healthcare, how we think about healthcare, and just how aligned that is, which I think is just so awesome and so powerful to know that, hey, when somebody reaches that point, we always have those as chiropractors, those couple people, they might be getting a surgical consult, they might have something where we just can't get them over the hump with what we're trying to do, to be able to have a team of people beyond the four walls of our own office, specifically in Centeno Schultz Clinic, I think is awesome. I know we are somewhat limited on time, so I want to push things forward a little bit, and I want to dive into TPI. There's so many chiropractors out there that are really focused in the sports world or take care of people that are active, weekend warriors, all the way up to professional sports. You had the experience, and if I'm not mistaken, you're the only physician of your kind that's TPI certified in your entire state. I guess just walk through that process. So many docs out there I know, aspire to get there, to learn, to see what it was like. What'd you learn? What was the process like? I'd love for you, just personally, I'm interested. What was it like going through the TPI certification, and what kind of tools do you come out with on the back end that get you pumped and that you can kind of apply in your practice day to day?
Yeah, so TPI, the Titleist Performance Institute, it works very congruent with how we think at Centeno Schultz Clinic, in that the body, it's like no man is an island, the popular phrase, and no body part is an island. And another thing I tell patients is, just like the song we learned when we were 5, the ankle bone's connected to the knee bone, connected to the hip bone, and so on and so forth. Well, it still rings true today in that everything is connected. And if something is dysfunctional, the other areas may either be the cause of that dysfunction, even though that specific area may not hurt, or may ultimately become dysfunctional because of a knee, because of a hip, because of a back, whatever it is. And the way the TPI philosophy is that you have to correlate the body with the swing itself. The golf swing is very complex in nature, and the old adage is, you think, it's just fat retired guys that go out and hit a little white ball around a field. Well, if you look at the top professional athletes today, you could probably not tell a difference between them and professional basketball players, minus maybe a couple inches of height, or other elite professional athletes in other sports, unless they were on the golf course wearing their polo shirts and slacks and things like that. Just their body, their physical build is made to be an athlete nowadays, and it's getting even more so at the youth level, because the elite amateurs and the college athletes that are ultimately going to turn professional, or at least hope to, they spend more time in the gym probably they do in the golf course right now, because we know that we have to get the body into optimal shape, optimal conditioning, and firing appropriately in order to ultimately give you the best ability to hit longer drives, shoot lower scores, and then for us people that are professionals and that maybe have a few more years on us, just longevity of playing and being able to play into our 60s, into our 70s, into our 80s, and not feel like that we need to take a nap immediately afterwards. So TPI really looks at that body swing connection, and the process in which we do the TPI screenings looks at a number of different areas, from head to toe, finding dysfunctions in areas. And even the professionals that have gone through the TPI screenings, I think there's only 1 or 2 of the professionals that don't have dysfunctions in a specific area. So the way we look at it is that, is your swing causing these dysfunctions, or are these dysfunctions causing you to swing the way you swing? Because every person's golf swing is like a snowflake. They're all fairly similar for the most part, but we all have our little differences amongst each other. And I think that's the big thing. And I'm not going to teach you how to swing the golf club because I have enough problems of my own knowing how to do that. But as far as finding areas of dysfunction that we can improve through the therapies that we offer is really what I harness and focus on, and trying to work with other TPI certified professionals, chiropractors, physical therapists, golf pros, strength and conditioning pros, and we all collaborate and work together because I may see a patient one day, whereas a therapist or a chiropractor may see the patient once a week or twice a week for a number of weeks together. So they see them at different periods of time, whereas I see that patient for an hour for our new patient evaluation just on that one day. And then I would see them on the day of treatment. And then I usually don't see patients for a couple months afterwards because we want to give their body time to heal. So I like having that feedback for somebody that may see the patient a lot more frequently than I do. So we get that information and then we can adjust potential treatment or rehab plans following.
I love where you're going with that. I want to be respectful of your time, but I want to make sure that people really get the details and the significance, the nuances of what it is that we're talking about here. And what I'd love if you would go into in more detail is, what you really specifically do. It may sound elementary, but a lot of chiropractors, a lot of these terms are generic. Even if you said, I went to a chiropractor, we don't still know what happened at that chiropractor because there's all kinds. So to get specific and get detailed, when you do your extensive hour-long evaluation, we've watched them. Jeff and I have been to the clinic. We've watched the thoroughness of what you do, how detailed you get, and how you look at function more than symptoms, how you're looking at the anatomy and physiology more than just how do I get rid of, through basically drugs and surgery, the end effect, the symptom. What do you specifically do so chiropractors can understand, oh, I get it, this is when I would want to refer to somebody? So I guess two questions. What conditions do you most, like to work with, or are you most effective working with, and how do you work with those conditions?
Yeah, absolutely. To answer the first question, we are musculoskeletal physicians by nature, so we diagnose and treat musculoskeletal conditions. So, autoimmune diseases, things like that. That's not our wheelhouse. There are other experts available for that. But let's just take the knee, for example, because the knee is probably the most common thing that we see. And I hear patients all the time that say, I've got a meniscus tear. Okay, great. So you're over the age of 35, so you probably have a meniscus tear and you haven't even known about it for a long time. But is that really what's causing the issue, causing your pain, causing your dysfunction? Well, in most cases, probably not. It probably has related to the instability of the knee, which we can assess by physical exam, getting our hands on you, as well as doing a diagnostic ultrasound, which is additional imaging that we do in office for 99% of our patients. And we can actually see the integrity of those ligaments under stress, because say you get an MRI that told you had a meniscus tear. Well, that MRI, you were sitting in the tube or laying in the tube where you're not actually moving. Well, the last time I checked, we have to move all the time. So we actually want to see what the body does under that movement. So, okay, so you've got some instability in your knee, you got some arthritis, you also have a meniscus tear. Well, how or why did that happen? Maybe in your low back, which is the circuit breaker to your legs, including your knee, you have some low-level nerve injury, not to the point where it's causing numbness and tingling going down the leg, but the communication signal that's being sent from those nerves in the low back that travel to the muscles that help stabilize the knee aren't working properly. So we can assess that as well through our physical exam and also treat that. And the good thing with how we do our treatments through your own blood or your own bone marrow is that we're able to treat multiple areas at the same time. I had a patient earlier this week that I treated, 2 shoulders, an elbow, the neck, and both TMJ joints in the jaw. So all in the same day. It took about an hour and a have to do, but we have the capability to do that, to actually fix the functional problem that's going on rather than just masking the symptoms that you experience. And that's ultimately what it's all about, is really getting to the core or the root of the issue and helping it heal.
That's awesome. And I know a lot of docs out there. We talk with a lot of docs, and as docs ourselves, it's the wear and tear of the physicality of being a chiropractor can be pretty aggressive. There's a lot of docs out there that get into their 50s and 60s, and their body is wearing down, if not beforehand. What's been your experience so far as we kind of come to the close on actually taking care of other docs? I know all of us, whether dentist, chiropractor, whoever it might be, there's a lot of physicality that goes into taking care of people each and every day, including yourself for that matter. What's been your experience with taking care of other docs? Is that a thing? How often do you see it? And what are your thoughts on it?
I would definitely say that's not an insignificant portion of our practice, just because those that are, I'll say, in the know about regenerative therapies and about what we do to help the body heal itself, these professionals want to keep on practicing. They love doing what they do, but sometimes physically they're just not able to do it. Being a massage therapist, being a chiropractor, being a physical therapist, being a surgeon, what have you, it does take an immense toll on the body because you have to sacrifice yourself, unfortunately, for the benefit of others sometimes. And, us that are in this field, we put our patients first and put our family second, sometimes alternating those. But moral of the story, we put ourselves very, very last at the very end of the road. And so we would like to see those people a little bit earlier, but it does make up a good portion of this and being able to get them back to doing what they want to do. And most of the time, I'll say those professionals will listen to us as far as this is what you need to eat, these are the supplements you need to take. More importantly, these are the medications you need to stay away from in order to get your body to better or at least optimize its healing, because that's what it's all about. It's optimization of getting your body to heal itself. And with what we use that comes from your own body, your own blood, your own bone marrow, your own adipose, whatever it is, and every patient's different, and what we're treating is different from every single patient. It's allowing your body to heal itself in the most optimal fashion.
Dr. Money, as we wrap up for everybody, I'll just point out a few things for our chiropractors. One of the things I love most about working with you and the doctors at Centeno Schultz is if I were to close my eyes, you guys would sound like the smartest chiropractors in the room. If I didn't know your degree, you guys are like us. And what I mean by that specifically is that, you've got very much the same philosophy that we do. The body was made to heal itself. You do everything you possibly can for those injuries that, aren't beyond the limitations of matter to encourage the body to heal itself. You very much include, integrate, and understand, acknowledge the value and importance of alignment. That's not insignificant. We all know that millimeters of movement and motion chronically putting pressure on nerves, as you said, the circuit breaker to the legs. Again, a core philosophy of chiropractic, something that seems to be lost on much of the medical field. And, you do the same thing. You work really well sort of co-managing or really focusing on the patient's needs, not just the doctor's needs. All very much, I'll say philosophically completely congruent with our philosophy and beliefs. As we wrap up, let me ask, what is it like to co-manage a patient with you? If a chiropractor has somebody they think you might be able to help, what do they do? What does that look like? Are you willing to talk to chiropractors and just sort of take their consults and find out if this is or isn't a right referral? How does that work? Talk us through that.
Yeah, absolutely. For a professional to a professional conversation, you can message me on Facebook. I'm not the best about replying, but I'm trying to get better like most of us. I'm pretty active on my Instagram account. My Instagram is golf.usa. So I have potential patients and other professionals message me on that fairly regularly, just asking, is this something that you do? Because a lot of people don't know about the capabilities that we do have here at Centeno Schultz. If it is just trying to get more information about scheduling a patient, you can reach out to our physician liaison, Sarah. She's a great resource. if you kind of already, you and the patient have already agreed, hey, this is something we want to consider, we want to do. But if you have any questions, kind of about professional medical questions, feel free to reach out to me at any of those avenues, and I'll try to get back with you with the knowledge that I have. And more often than not, even if a patient has been told they're a surgical candidate, we usually can avoid that surgery and get the patient back to doing what they want to do faster and without getting cut on, unfortunately.
I just want to emphasize one more thing so everybody gets this. When a chiropractor refers a patient to you, it is your, professional belief and, what I've seen consistently, you will refer that patient or make sure that patient gets back to the referring chiropractor. That this is not like surgery where they send them to the surgeon and then the surgeon goes, oh, stay away from the chiropractor. But in fact, it's the opposite. That when they come to see you, your actual recommendations are get back to the referring chiropractor for what you described earlier is that ongoing work to make sure that they stay in alignment after you've done what you do to them, so that the chiropractor can professionally know that you are going to respect that relationship that they have with the chiropractor. And I bring it up only because it's refreshing to have medical doctors and osteopaths be able to cross-refer, co-manage clients. Unfortunately, unlike much of the medical field that just sort of goes, well, I'm glad you're here, you don't need that anymore. So I just want to make sure chiropractors know that it's not, referrals aren't going into the black hole of never coming back. In fact, it's a boomerang effect. When you send them, they do come back. So Jeff, if you want to wrap it up, just want to make sure everybody understands how you work and how you co-manage patients with people.
That's a great point, Jason, and thank you, Dr. Money. This has been awesome. It was great to learn more about you. I'm looking forward to having you back on. Maybe we might get some show and tell, some TPI stuff going on the next time. We'll put a little pressure on you there. But it's been awesome to get to know you a little bit more. We'll drop all those links down below. So if you're watching this on the replay or live, we're gonna drop Dr. Money's links down below. Follow him on Instagram. If you have questions, hit him up. Him and the entire Centeno Schultz team is available also at thesmartcarenetwork.com. We'll drop all those links down below. Dr. Money, I know you have to run. You have a packed day. Thanks for coming on today for Clinical Conversations. We'll talk to you very soon. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.